Every hospital leader knows the pain of supply shortages, whether it's gloves, implants, or critical devices. It always seems to happen at the worst possible time. And yet, fixing healthcare supply chains has felt like an impossible puzzle. Here at the Oracle Health Summit, Oracle unveiled new supply chain capabilities powered by automation, robotics, and AI. Their promise is to make shortages more predictable and stockrooms more efficient. I sat down with Kristen Miles, Vice President of Healthcare Product Strategy at Oracle, to find out more. Let's get to it. Kristen, welcome back to the program.
Thank you. It's nice to be here.
It's exciting to have the chance to talk with you again. We spoke last year at this event in Nashville.
Yes.
More excited to be here in Orlando.
Yes, very nice.
Now, Kristen, before we get started, for those that may not be familiar with you, can you tell us a little bit about your role and a little bit about what you do at Oracle?
Sure. I am the Vice President of Healthcare Product Strategy for Fusion Applications. So I'm responsible for helping make sure that our HCM, supply chain, ERP solutions really meet the unique needs of healthcare.
So, Kristen, you and I spoke last year a little bit about supply chain, but a lot has happened in that intervening year,
Yes.
including a lot of turmoil around global supply chains, which has really put that aspect of hospital management back in focus.
Yeah.
Now, on top of that, Oracle has announced and Oracle Health have announced some new supply chain capabilities. So can you talk to me a little bit about that?
Yeah, so we have continued to invest for healthcare in our supply chain application. So we've got some exciting new things around automation with RFID technology, robotics automation and integrations, as well as advanced inventory capabilities that really help our healthcare customers manage their inventory, understand when shortages are predicted to happen, things that today, well, previous to today, they couldn't do. That was somebody manually looking at spreadsheets or just hoping for the best.
So when we talk about inventory, what are the kind of things that we're talking about for health systems?
So if you think of inventory, it's going to be your commodity type supplies, your PPE, your gloves, but it can also be those heart valves that are needed for a surgical procedure, implants, etc. So it really spans the gamut. Folks keep lots of things in their inventory.
So you mentioned a word there, advanced inventory management. How does that help organizations keep things like you just mentioned, the valves and the PPE in stock so that they're there when they need it?
Yeah, absolutely. So what we found with hospitals is that just being able to manage supplies inside of a PAR location, for an example, didn't necessarily get them all the way there. They needed ability to group like type items to help create efficiencies in the picking process to make sure that it took less time from the point of requisition to being able to get that into a nurse's hands. So our advanced inventory allows for like type items, like being able to be picked together, or conversely, you don't want to pick a needle with a bag of saline, right? So being able to use logic in picking scenarios. In addition to that, being able to, we have license plating that we announced, which allows you to group items together and move them as a single unit, which is really helpful instead of having to scan in every single item. In addition, truck loading, being able to take things from an offsite location and bring them to the hospital, maximize the information that you have inside of that truck, not the space inside of that truck. In addition to that, robotics automation, being able to deliver your supplies automatically. No human is picking up that box and walking it out. Instead, they're able to use a robot, which is really cool to see. I think today we see them on college campuses delivering food. Now imagine that they've got medical supplies in there.
I want to go there because you did announce, or Oracle has announced some new partnerships with ST Engineering, Atheon for robotics.
Yes.
Now, is that specific to inventory and inventory management? Can you tell me more about that?
Yeah, it is. Aethon, ST Engineering, Aethon is an amazing partner. They're already in some of the most strategic healthcare providers in the country and actually globally. And we've partnered with them so that we can take, when a delivery has been picked in the storeroom, you can now notify automatically the robot to come pick it up. Robot shows up, you put that cart into the robot and off they go. They can manage elevators, they know which floor to go to, and then they can drop that off efficiently. So you no longer have to have people, which means that those people can be redeployed to do other things, which is, I think, what we're all looking to be able to do in this day and age.
So with Oracle, that whole system is integrated, I'm assuming, right? Right from the picking and knowing all the way through to letting the robot know where to take things to get it to point B where you need it.
Absolutely. And it goes so far as to say when the robot drops off that package, it sends a notification to say delivery complete. So we know not only that the package made it, but also how long it took to get there. Sometimes we get phone calls from nurses saying, I never got my package. We can show you who signed for it. It's all in that system of record in the ERP.
Now, you used a few terms when we were just speaking, truck loading, license plating. I'm assuming these are things that Oracle has learned from other parts and other industries, and is sort of bringing that to healthcare.
That's exactly right. So I think one of the things we may think that of hospitals as being a bit of a laggard when it comes to some of the processes. But what they've started to do is open up their eyes and say, what is Amazon using for really great, proficient, and efficient supply chain processes? So we've been able to glean that from other industries and take those processes, but they don't need everything. And that's the place where we're sitting in that sweet spot between needing a full warehouse management solution or just needing a really, bare minimum inventory solution. There's this middle ground. They need a little bit more, and they need those things like license plating, cross-stocking, things of that nature.
At least in healthcare, we don't have to worry too much about warehouse management just yet.
Just yet.
But more like inventory control and all the stock rooms that we have spread out across the facility.
That's correct.
But I like that. I mean, I'm going to assume that a lot of the best practices that you're bringing from other places have been really well-worn, well-tried. And so healthcare isn't really sort of blazing the new trail when it comes to inventory.
No, that's true. We're able to take that information, retail. I mean, hospitals are very similar to retail, right? In that they have unpredictable demands in some cases. But retail has gotten their arms around those predictions and being able to know that right before Christmas, maybe everything's going to blow up and they're going to have a lot more demand. We're able to start to do that for healthcare too, to prevent those stockouts. And now we're able to apply AI to it to say, hey, there's a danger that you're going to potentially stock out. Let's take a look in this area to make sure that we can level that out so that they're not running out of things in one bin, but overstocked here in another.
Is that where AI comes in, Kristen? I mean, we're here at the Oracle Health Summit, and AI in action is sort of everywhere plastered on the posters behind you. Is that where AI can really make a difference in that leveling that and really helping with that predictability of inventory?
Absolutely. It can be monitoring and taking care of what levels are and knowing that based on historical predictions, here's what we think is going to happen and you don't have enough. And surface that and take action on it. Historically, it's been people having to say, monitoring that or waiting for the phone call, I don't have any in my bin. And then you're starting to take action. With AI, it's doing that and monitoring that for you and then giving you the suggestions. And even if you wanted to, taking action to fulfill an order.
And Kristen, what is it that AI is monitoring? I'm assuming, of course, that the Oracle EHR, with its knowledge of what procedures are going to happen that day, the surgical schedule, are those the kinds of things that it's monitoring to look at inventory?
That's where we're going.
Okay.
So absolutely. And actually, I just saw something today that was built by a partner that said, tell me what I'm going to need based on my surgery schedule for the next 4 weeks. And then it compared that to what I had on hand or on order and said, here's a possibility of running out. What do you need to do? And it can take action. That's exactly what it's doing.
So if we look down the road a little bit, someone who's implemented all of this wonderful inventory management technology, what does that world look like in terms of, what does it feel like for the physicians and the clinicians? What does it feel like for the people working with those materials?
I think the vision is that the clinicians and the physicians are able to see what's available. If they're making a recommendation or putting in an order, they're able to say, do we have that today or don't we have that today? If I don't and I know I need it, what are my alternatives, right? Being able to surface that at the point of care as opposed to going back and doing some documentation in the back room and not knowing whether or not that product's going to be there because you've already had that conversation with the patient. And then on the operations side, making sure that things are moving seamlessly. We're only having to stop when something is not as we expected it. And we're surfacing those exceptions and taking action there. as opposed to having to monitor, go up and count, right, each product, etc. I think that's the vision, is bringing everybody closer to the data and allowing that AI to do the work for you so you can work on more strategic things.
And it sounds like it's a lot less manual effort, right? I don't have to go and do the stockroom stuff every time. I'm not fielding the phone calls, as you call it, because there's fewer exceptions for me to deal with. Is that kind of the idea?
That's exactly it, right? Sending somebody up to count how many gloves I have in a bin, while super important today, it won't be important tomorrow because the system will know how many are there. Whether it's doing it through RFID, whether it's doing it through optical recognition, it knows that we've taken out 20 today. We need to keep going, right? Or we need to replenish that. So that's the future.
Now, Kristen, if I was to ask you, of course, we've been talking about AI in the inventory and supply chain side of healthcare. Where else are you excited about AI in healthcare?
Oh gosh, my most exciting place is bringing all of the data together to start to be able to say what products, right? If I have my supply chain hat on, what products, and then when I look at HCM, what skills do my staff need to be able to deliver the very best outcomes? So before the patient even arrives at our door, we know the right products. We have a really good idea of the sizes that are going to be needed for maybe an implant situation, so that we're carrying less inventory, we have less overhead, and we're really making sure that staff have the right skills to deliver that care based on data, which gives our clinicians a lot more comfort.
Yeah, you mentioned something there that I hadn't really thought of about the staffing requirements, because some of these supplies require certain knowledge, certain skills, maybe even certain training
Yep.
in order to operate and use them. So
Yep.
matching that up and making sure that we maybe not have forgotten that we needed this person or this skill set in the room while these were being used.
Absolutely.
That's kind of what I'm hearing you
That's
saying?
exactly right. If you think about critical care, right, and having a patient come up from the operating room and they're coming up on a balloon pump, as an example, you need a balloon pump certified staff to be able to accept and take that patient. So if you think about being able to manage that in your HR record, that I have that certification and communicating that to your staff assignment module, as an example, that's critical information to make sure patients are well taken care of.
Kristen, if we were to look at our crystal ball and say, when we get together next year, same time, what are we going to be talking about next year?
Gosh, I think we'll be talking about all of the information and benefits that customers have realized from putting these agents into place.
I love it. Final question for you, Kristen. Where can people go to learn more about Oracle's supply management solutions for healthcare?
Oracle.com/ERP.
Amazing. Well, Kristen, thank you again for coming on camera with me and
Thank you.
telling me more about this important aspect of healthcare.
It was so good to see you. Thank you very much.
I loved that conversation with Kristen. We started with the frustration every hospital knows, stockouts that derail care. But we ended up talking about solving it with automation, robotics, and AI. What stood out to me is how Oracle is pulling lessons from retail and other industries that have already mastered inventory at scale. So instead of reinventing the wheel, healthcare can tap into proven practices like license plating and truck loading and predictive AI to solve its supply chain challenges. Check out the other interviews from here at the Oracle Health Summit through the links below. And hey, if you enjoyed this interview, please mash that like button and click subscribe for more great interviews like this. I'm Colin Hung. Thanks for watching, and I'll catch you on the next video.